Hello, welcome to your Breathe Easy education. My name is Sarah Mackenzie. I'm one of the respiratory therapists working in Breathe Easy in Red Deer. And today we are going to continue talking about those breathing action plans. So last session, we introduced the action plans, and we kind of went through how they are structured, what is the point of them. And then we talked about how to work through this document if you think that you're getting a chest infection. So, does anyone remember those two symptom changes that you're looking for that can help you to hone in on the fact that you might be getting a chest infection? If you said increased shortness of breath with normal day-to-day activity and changes in your mucus or phlegm, you are correct. So this is why it's really important that we are aware of how short of breath we typically get doing day-to-day activities. Because if all of a sudden you're way more short of breath doing your day-to-day stuff, that's a cause for concern, right? That's something to pay attention to. Same with your mucus or phlegm. The change in color sometimes occurs a few days before you start to physically feel sick, which creates a bit of a window, right? So that 48-hour mark is the maximum amount of time you'd want to let those symptom changes occur before you activate your pharmacy action plan and obtain antibiotics and prednisone. Early detection, early treatment. This will preserve the lung function you have left, okay? So that's what we talked about last time. Today, we're going to continue talking about the breathing action plans in relation to aggravating environmental factors. That is a mouthful. I prefer the term triggers. So things in your world, we'll talk about all of the indoor and outdoor stuff that can bother your breathing. Hopefully, you have an idea as to what these triggers are specific to you. Everybody's a little bit different. But identifying what's in your world that bothers your breathing is really the first step. We'll talk about strategies to avoid or reduce your exposure to these triggers. And we'll talk about strategies to manage the worsening of your symptoms or an exacerbation caused by exposure to environmental factors, okay? So let's talk about some of the environmental things that could be triggers for you. We have indoor pollutants. These are things like cigarette smoke, household cleaning products, strong odors. We're talking about perfumes, scented candles. Dust can be a big one as well. So anything that you're sensitive that can affect the air quality, and we'll talk about air quality a little later in the presentation. So that's indoor stuff. Luckily, there are some really good natural scent-free cleaning products out there. So if you know that you're sensitive to strong chemical smell, I would explore some of those. I had a gal in our previous class say, oh, you know what? Every time I do the laundry, I'm always coughing. I wonder if it's my scented laundry detergent. And so she switched that out for a fragrance-free laundry detergent, and lo and behold, her coughing disappeared. So things like that to pay attention to. So we also have outdoor pollutants. So things in the air that we can breathe in that affect the air quality. So exhaust fumes, gas fumes, smog is a big one. If you ever have to go to downtown Edmonton or Calgary and you're sensitive to smog, maybe you'll notice that. So those are pollutants. Exposure avoidance and reduction of those pollutants. So a big one, if you're sensitive to cigarette smoke, don't smoke and avoid being in close proximity to people who are smoking. It's pretty common that people with lung disease, years after they've quit smoking, smoking actually becomes a trigger. So you become sensitive to it and it worsens your breathing when you're exposed to it. It's quite interesting. Does anyone know what third-hand smoke is? So there's firsthand, you are the one smoking. There's secondhand, you're breathing in other people's exhaled cigarette smoke. Third hand is cigarette residue found on clothing and surfaces. And third hand smoke contains chemicals and carcinogens, known cancer-causing agents as well. So it's important to avoid all three types of cigarette smoke. Avoid strong odors and dust. So again, if you're sensitive to perfume and Aunt Susan likes to douse herself before family dinners, have a conversation with Aunt Susan and say, hey, look, I literally can't breathe when you're around. Could you avoid that heavy musky perfume, right? Obviously, that's an exaggerated example. If you're sensitive to scented candles, avoid burning scented candles, things like that. And if you're sensitive to dust, especially asthmatics, sometimes it's recommended that you actually remove the carpets in your home and put in either vinyl plank or hardwood, whatever you decide, so that you can clean it a little bit better. Dust always sits in carpet over time. Avoid exhausting gas fumes. So you may need to plan your exit from the store to your vehicle to avoid walking through exhaust. And some people are very sensitive to this. Avoid smog and forest fire smoke. So yeah, easier said than done when it's forest fire season, right? But there are some things you can do to reduce your risk. We'll talk about air quality here in a little bit, and paying attention to what the air quality is and what the warnings are, and adjusting your schedule accordingly so that you're not going outside when the smoke is thick in the air and then suffering the consequences for days or weeks after, okay? And smog. So if you do have to go downtown in a bigger city and you know smog bothers you, you can wear an aerosol mask. So those medical masks that we are all well versed with now that we've lived through COVID. There's a reason why in Asian cities and countries they wear those masks, because they do a very good job at filtering out that smog particle. Okay, so that's something that you can try if you're sensitive to smog. More information, there's a contact for the Lung Association. So emotions. Emotions are also factors that can negatively influence our breathing. So there's anger, anxiety, and stress as examples here, but positive emotions can have the same effect. Any rapid swing in emotion has the ability to negatively affect your breathing. So I'm not saying don't feel feelings and be a robot, but know that it does have the potential to affect your breathing. Has anyone ever had a fit of laughter after a joke, or you're with family or friends and you're enjoying yourself? Next thing you know, you're coughing. Next thing you know, you're short of breath. So that is quite common. And it's important to know that, you know, you can do your breathing techniques and you can get over that situation. Same with anger and anxiety, right? So if you're angry, you're not breathing, you have the potential to get short of breath. And anxiety or stress, right? So you're not paying attention to your normal everyday tools that you use to manage your breathing, and so thus you might end up in a situation. So it's important to remember. The next presentation we'll talk more about some different relaxation techniques to help to combat the emotional effect of our lung disease. So if you are stressed or anxious, talk to your support people, okay? So anxiety lives up here. We are up in our brain. It's very isolating. We think of the worst case scenarios, and that's what we're worried about. Sometimes it's as simple as having a conversation about something that you're worried about. A lot of the time, we are making a bigger deal out of it in our brain than it actually is. And we can feel some relief, and we can also feel that connection by talking about our feelings with the people that are important in our lives, right? So it's something to pay attention to. If you're up here more than you're out here in the world, you need to have some more conversations. Breathing, as I mentioned before, breathing and relaxation techniques come in really handy here. So again, your breathing techniques are really your most important tool. They can get through almost any situation. They can improve. So that's emotions. Changes in temperature. So this is a great one because in Alberta, we're lucky enough to experience all of these extremes, sometimes in the same calendar day. So you may already be aware of which of these bother your breathing. Some people are lucky enough that every single one of them bothers their breathing, but it's important to keep in mind that we need to take additional measures during these times of extreme temperature changes, so that our breathing doesn't suffer, right? So we have extreme hot, extreme cold, high winds, humidity, also extreme dryness. You know, in our winters, it's very, very dry. So all of that has the potential to bother your breathing. Some things that you can try in cold weather: dress warmly. Why is this important? When we're cold, we do this, right? We hunch over, we get nice and stiff, and our lungs aren't able to expand. This is not a good position to breathe from. So you dress warmly, you can relax your shoulders, you can fully expand your lungs. Makes sense, right? Cover your face with a scarf or mask only if this doesn't make you more short of breath. So if it's extremely cold, like -40 or below, and you need to go from your house to your vehicle, say, or from a store to your vehicle, sometimes covering your face with a scarf or a mask just in that short term can prevent that cold air from hitting your lungs and ripping the air out of your lungs as it feels like it does. So it's something to try, right? Just that short term can protect and help you to feel better. So hot weather, stay in an air-conditioned room. Well, if you're lucky enough to have air conditioning, that's fabulous. And if air conditioning doesn't bother your breathing, which for some people it does, that's an option for you, okay? For the rest of us, sometimes having select windows open in your place to create a cross draft, having fans going so you're breathing fresh air can help. Drink plenty of water. So it's always important to stay hydrated, especially when it's really hot out. We are going to be sweating more, so we're at a higher risk of becoming dehydrated. What do you think being dehydrated does to your phlegm? It makes it thicker, right? So now you're going to have a harder time coughing out the phlegm. You're at a higher risk of chest infection. That's not a situation we want to be in. So drink even more water than you think you should on those really hot days to keep yourself hydrated. Avoid strenuous activities. So when it's 35 degrees out, this is not the time to be going for a long walk. This is not the time to be really taxing your body even more, because it's extra hot and you're at a higher risk of dehydration, heat stroke, none of those good things. My boyfriend and I were in Mexico last year, and I just had to shake my head. There would be people running up and down the beach during the heat of the day, like 1 to 2 p.m. It's like 40 degrees sweltering outside, and they're outside trying to get a workout. Probably have a better chance of getting heat stroke than you do of losing a pound. So definitely not recommended. And wear light clothing and a hat. So keeping your head covered will keep your face protected. Hopefully you won't get a sunburn. And that light breathable clothing, they actually have a lot of clothing now that has UPF, I believe it's called, 50. So your light clothing also serves as sun protection. So it's kind of a dual purpose now. So keep yourself protected in either extreme or cold or extreme hot weather, okay? So we talked about this last time, but I'll reiterate, respiratory infections. So obviously, if you have a chest infection, your breathing is going to be affected. Things you can do to avoid your risk of getting an infection is to avoid people who are actively sick. If you have to be exposed to someone who's sick, say the grandkids come over for Easter dinner, try to avoid direct contact for a length of time and wash your hands often, way more than you think you should. And also keep your lungs clear of mucus. So mucus is that last place where bacteria can be trapped, and then we cough that out to get it out of the lungs. If our mucus is sitting in the lungs, that bacteria has a chance to grow. And that's really where chest infections come from, right? So keep those lungs clear by doing your breathing techniques. If you do have phlegm as a part of your day-to-day lung disease symptoms, those coughing and huffing techniques and or mucus removal devices can be very helpful, okay? So, and stay up to date on your vaccinations, always. It'll reduce the symptoms that you experience if you do get sick, which is literally the difference between you feeling yucky at home and you spending 1 to 2 weeks in the hospital, perhaps even ICU. And if we're talking about slowing the progression of our lung disease, A super big double lung chest infection is not the way to do that. So we need to protect ourselves and give ourselves the best chance at having just a very mild version of whatever you get. So allergens can also affect our breathing. So you can have allergies associated with any other lung condition. You can have allergies on their own. A lot of times allergies and asthma correlate well. So it's important that we identify the things that we are allergic to. So typically, allergic symptoms show up in the sinuses. So you have runny nose, you're sneezing, itchy eyes, stuffed up. That it can also get down in your lungs. We have several allergic responses in our lungs that can cause inflammation and increased mucus production. So some of these culprits can be pollens, molds, animal dander, and dust. Specifically, when we're talking about dust allergies, it's the dust mites that we react to. And there are plenty of others. If you're not sure what you're allergic to, I would suggest talking to your family doctor about getting allergy testing done. It's a skin prick test. They have multiple allergens that they inject just into the surface of your skin, and then they watch what happens to your skin afterwards to help to identify where the sensitivities are. And nowadays, they're pretty good with immunotherapy. So if you are allergic to, say, grasses or pollens, you can actually, over the course of a few years, take very, very small doses of those allergens to slowly, over time, reduce your immune system response to these things. And the hope is that eventually you have no response or such a minimal response that it's not affecting your life anymore. So if you have allergies, I would suggest going down that route just to properly identify what it is that you're reacting to. So things that you can do in the meantime: avoid outdoors when pollen levels are high. So we can get our pollen report on the Weather Channel. I also have an app on my phone called Weather Canada that will alert when pollen levels are high. Another way to tell is look at your vehicle. If it's covered in yellow dust, that's a good indication that there's a lot of pollen in the air. My old place had blue spruce trees all along the west side of my house, and I could look out the window in the spring and literally see the pollen puff out of the trees. And I immediately grabbed an antihistamine because I knew it was going to be a rough day, right? Keep your living area clean, dry, and pet-free. Well, if you're like me and you're allergic to your cats, that's a decision that you make, right? So for me, I can keep my symptoms at bay with antihistamines, and it's worth it to be able to enjoy having my two beautiful kitties. But obviously, my allergies to my cats are fairly mild. So if you have severe allergies that are actually affecting the quality of your life, that's a decision that you might have to make. Right. And if you're sensitive to dust, again, like I mentioned, sometimes the decision is to remove carpets from the home and just make it so that there's the least amount of allergens possible in your house so that you can feel like you're safe and at home there, right? So let's talk about some management strategies. So if you cannot avoid your triggers, try to reduce your exposure by limiting your exposure time. You can try wearing a mask. So if you're going downtown Calgary, you know smog bothers you, wearing a mask can limit how much of that actually reaches your lungs. You can try using your reliever medication. So there's two ways to do this. Some people find it really helpful to take their Ventolin before they're exposed to a trigger. And what this does is it relaxes the smooth muscle and it actually prevents as severe a response. You can also take it when your breathing starts to change, but sometimes it takes longer to get over the hump when you already have those symptoms pop up. So the only way to know which one works for you is to try. So it's, for example, if you have exercise-induced asthma, try taking your Ventolin 15 to 20 minutes before you start your exercise and see how your breathing feels. You could also wait until you feel a little short of breath, take your Ventolin, give it a few minutes to work, and then continue on and see how you feel. You'll know which one works better, and then you know which one to do in the future. Okay. And use your breathing relaxation and body position techniques. So if, say, you head out of a store and you get a big, full double lung breath of diesel exhaust, and you know you're sensitive to diesel exhaust, what you don't want to do is go into a full-on freak out. Oh no, I got that exhaust. I know I'm sensitive to it. Now my breathing's going to suck, and now my anxiety is bubbling up, and I don't, where's my Ventolin? I can't even find it. And obviously that's an exaggerated version, but what you can do if you don't remember your tools is you can actually make the situation worse. So if you're anxious, you start hyperventilating, you're going to air trap, and it's going to take longer to overcome that situation. So it's really helpful what you say to yourself in those moments, right? Like, oh, okay, I wasn't expecting that. I need to sit down on this bench. I'm not even going to worry about getting to my vehicle right now. I'm going to do breathing techniques. I have my Ventolin with me. I know I'm prepared. I can get past this situation, right? I have the tools to get over this. It's going to be okay. Okay, so what you tell yourself helps to dictate what direction you go. If you're like, oh no, I'm probably gonna have to go to the hospital now. It's likely to get worse before it gets better. If you remain in control and remind yourself that you have the tools, it's likely to get better, right? So follow your action plan. So in relation to your action plan now, this is yellow zone management. So we talked about green zone last time. You know, you have a good sleep, you wake up, your energy's good, you take your puffers as you should, you do your breathing techniques, use your aerobica, whatever else you're doing on a day-to-day. You're in the green. If you get a big breath of diesel exhaust fumes, that pops you into the yellow. Anything that changes your breathing and changes your symptoms pops you into the yellow zone. So this can actually happen multiple times throughout the day, right? Oh, I had to run up the stairs to grab the phone in the other room, and now I'm short of breath. Yellow zone. So all that means is something's changed. I need to change my management in the short term to resolve the situation and get back to the green zone. Okay. So when we're talking about chest infections, when your symptoms change and you need to start antibiotics and prednisone at the 48-hour mark, you're likely going to be in the yellow zone for a few days, right? You have an infection, you're likely going to be coughing out green, more short of breath, more tired, whatever else you typically experience. And then eventually, once that infection resolves, your symptoms normalize and then you get back to green. When we're talking about exposure to triggers, you know, you're in the elevator next to a woman that's wearing very strong perfume and now you're short of breath. That's a short-term jump to the yellow zone with short-term changes that should hopefully help you get back to the green zone very soon, right? So you get off the elevator, you take a seat on the bench, you do your breathing techniques, you take your Ventolin, maybe give it a beat, maybe you need 5 minutes, and then you're feeling like you can move on again. So the point of that is to recognize what happened. And that is high-level awareness. This is going to take a lot of practice. Knowing what you're sensitive to, and for the most part, trying to stay organized to reduce or eliminate those triggers from your life will drastically improve your breathing. And when you are exposed to those things that you don't see coming, you know you have the tools to change a few things, give yourself time to breathe, take your Ventolin if you need, and then next thing you know, you're back in the green and you can carry on with your day. So a lot of times people don't recognize, so either you don't recognize and are fully aware that there are changes happening, or your stubbornness and your ego, you push through it and you just say, oh man, I know perfume bothers me, but I gotta get to this appointment. I can't stop for a rest. I just need to push myself. And by the time you get to your doctor's office down the hall, you're 10 out of 10 short of breath and you can't even talk to the receptionist, right? So this happens a lot because we're stubborn, right? Well, I always used to be able, it never used to bother me. I always used to be able to do it. Not the case now. So giving yourself permission to not only recognize those changes, but to do something about it immediately. That's the key, right? So that's what we're talking about here. So pad up your yellow zone, whether you're working with the 2-pager, your yellow zone is here, lots of room to write. And on the 1-pager, your yellow zone is here. So pad it up a little bit. What things are you sensitive to? If you're sensitive, say, to seasonal changes, snow mold, pollens, is it recommended if you have asthma that you take your corticosteroid during those times? Get that on there, right? We need to remind ourselves of what our management strategies are so that we don't get too far down that road that it takes a long time to get back. Right? So if we're supposed to start our corticosteroid and as soon as the snow melts, in order to avoid the negative effects of the snow mold on our breathing and on our asthma, and you don't do that, you might end up in the hospital. You might end up that your lungs are in a state that you cannot manage, right? So this is high level awareness, and this is prevention and early treatment. Right? So respiratory masks. I won't take any time on this because this presentation was created pre-COVID. We are all well versed with respiratory masks at this point. I still have a stockpile of all different types of cloth masks that my mom made me. So we are good to go in that department. Let's talk about air quality. So there's indoor air quality. So any pollutants or scents or anything that is inside has the ability to affect the air quality inside. There's also things like carbon monoxide or radon. So making sure that your house has a carbon monoxide detector. If you're worried about radon, I believe the fire department can come and test for that. At the same, homework or school, if you are sensitive to smells, sometimes that means having a conversation with your employer, with your coworkers, just making sure that your environment is set up so that it's safe and you're not feeling negative effects, just being there, right? So outdoor air quality, residential wood burning is a big one. I had a guy yesterday say that he specifically notices a change in his breathing whenever there is residential wood burning. So he's very sensitive to that. And there's smog and other pollutants as well. So forest fires can be in here as well because it definitely affects the air quality. So the Air Quality Health Index, that is a helpful scale from 1 to 10 that helps determine what the chances of you experiencing negative effects on your breathing when you're outside. Pay attention to that. It's on the Weather Network. I see mine on my Weather Canada app. If it's 5 or above, if you have a lung condition, you are likely to experience negative breathing effects if you're outside. If it's 10 plus, which it does usually hit a couple times a summer, it's recommended that everybody stay indoors because the air is too thick. You cannot breathe it. It is not recommended. So stay inside with the windows closed, doors closed. And that might be a yellow zone day, that whole day, or until the smoke lifts might be yellow zone. So you're rescheduling activities, you're laying low, you're not doing any exercise, you might be taking your reliever puffer a little more often. Okay. And that's okay, right? We're doing what we can to manage something that we have no control over. And that's life sometimes. So I already kind of went over how to follow your action plan in this case. So we don't need to really go over it again, but pad up that yellow zone and just start to pay attention and start to communicate with yourself and with your loved ones. Oh, I'm in the yellow zone. I just need a couple minutes here. Oh, I just need to take my Ventolin. I'm feeling a bit short of breath after X, Y, and Z. I'll let you know when I'm ready to go again, or whatever that looks like for you, right? So we're hopefully you're already communicating with your friends and family if you're having green zone days, and also when you have yellow zone moments, right? So yellow zone with chest infections and yellow zone with triggers. So that's it for the trigger portion of the breathing action plan. This is presentation 2 of 3. Next time, we actually have a guest speaker that will speak to us about stress and anxiety management. And there are a lot of helpful tools that can help us through those moments as well. So hopefully you're starting to kind of get a feel for how this document works. Building your confidence. Definitely let me know if you have any questions whatsoever. The goal is to have a comprehensive document full of all of your management strategies by the end of the program. To summarize, use strategies to avoid or reduce your exposure to triggers. This will reduce the inflammation on your lungs and minimize your symptoms. One thing I do want to mention is the more you're exposed to your triggers, the more detrimental symptoms that you have, the higher risk of chest infection. So for example, if you're deathly allergic to cats and you're over at your sister's who has 4 cats a lot for a long period of time, you're going to have muscle restriction in the airways, you're going to have inflammation, you're going to have increased mucus. So those changes in your lungs are meant to be temporary. It's meant to be a temporary thing to trap whatever you're allergic to and get it out. If you're constantly exposed, you're at a higher risk of getting a chest infection. And when you get a chest infection, you knock your lung disease progression down a few pegs, right? You're advancing the progression of your lung disease, and your lungs never go back to the way they were before. So it's really important when we're talking about slowing the progression of our lung disease that we are taking these extra steps to identify and reduce or eliminate these triggers in our lives. Okay? So your action plan will guide you. Your action plan tells you what to do. Because in the moment, sometimes we forget our tools, right? So this is the point of having this document. So continue to write down, ask questions if you need. We're working towards completing this breathing action plan. And that is it. Thanks so much for listening, and let me know if you have any questions. Bye for now.